Good evening to all the participants of CBME, the group which is started by Sanjay Bedi sir. And I request the next group, the group G, to start their presentation. Please go ahead. Best of luck.
Thank you, sir. Good evening, one and all. On behalf of J Group, myself, Dr. Vidya, welcoming you all for our group presentation. First of all, I would like to share my heartfelt thanks to Dr. Sanjay Bedi sir for offering us a good platform to discuss our ideas. And next, also, I am also extending my heartfelt greetings and thanks to our facilitators, Dr. Pankaj sir and Dr. Parag sir, for giving their valuable inputs and suggestions in framing our presentation.
Please click on the PowerPoint slide and put next and go ahead, madam.
Yes, sir. Yes, sir. Yes, sir. Sorry for that lag on. I think now slides are moving on. Yes, sir. Are you able to see the next slide, sir?
Yes, it is moving. You
Yes,
can go
yes,
back
yes,
and.
yes. Okay. And this small video is about our group members, Dr. Chaitanya, Dr. Manuja, Dr. Chandana, Dr. Pallavi, Dr. Bayapredi, Dr. Gurmeet Kaur, Dr. Jyoti, Dr. Rajins, Dr. Rituparna, Dr. Dinesh, Dr. Shalini Ray, Dr. Maruf. This is myself, Vidya. Dr. Parnavadas, Dr. Mithila, okay, thank you. And today's presentation is going on in these lines. First, about the concept note on elective, and next sessions will be on assessment of knowledge and assessment of skills and formative assessment tools in community medicine. And there are two demonstrations also in this presentation. First presentation is on concept note on elective. I'm myself, Dr. Vibi Srividya, going to present this. So I have taken these points from the elective module of CBME. When we are going to prepare our elective, these are the things we need to keep in our mind to prepare about particular topic, objectives and timetable and learning resources and list of the activities, and also about formative assessment. And I have taken community-based epidemiological survey for writing the concept note of the elective. And the learning objectives are the student should be able to select appropriate research design, sampling method for the subject of interest, and to use standard data collection tools in field, to analyze the data by using any standard software, and to publish the work. And secondary objective is to do geographical mapping for any one public health event. Learning experiences will be learning experiences will be participation in faculty research and also student initiated research, and we're planning in urban health center field practice area in low socioeconomic population. And prerequisites will be for the students to know the basics of biostatistics, and for the faculty, ongoing research with institutional ethics approval should be there. And first week, the activities are mainly towards sensitization about ongoing research, and also giving introduction or about basics of research methodology, terms, meanings, and exposing them to the selected studies of particular area to develop conceptual framework. The informative assessment will be in the lines of analysis of research methodology for selected studies. And second week, continuing the review of literature on one particular public health event of their interest, student interest, malnourished children or diabetes, etc. One will be taken, and development of the questionnaire based on the standard protocols in methodology planning, and also hands-on training about data collection tools like Epidata or Kobo Toolbox in the field will be given. And in third week, data collection and geographical mapping um, will be explained, and they will be involved in doing data collection and also geographical mapping. In fourth week, final report preparation. And hereby I'm showing the Kobo Toolbox data summary. So I just wanted to tell you in the research in this elective, we are going to train them in important standard data collection methods, and also we are going to train them in standard softwares. So a Kobo Toolbox is almost like similar to the Google Form, except here we can add geo points also. And so the map is showing our just trial study for using geo points. So these round indicators, they are actually the cases or the we have entered in the Kobo toolbox. So this is one tool that the student is going to learn and apply during the data collection method. And this is the end of my presentation plan concept note for elective. And I'm inviting Dr. Jyoti for presentation of the assignment on knowledge. Thank you. Dr. Jyoti?
Thank you, Dr. Vidya. Am I audible?
Yes, you are audible.
Okay. Good evening, one and all. I'm myself, Dr. Jyoti, professor in Nutan Medical College, Gujarat. The assignment of knowledge is like a time to review and recall whatever we have learned in our large group sessions, basically in lectures. So, in line with that, assignment allotted to our group was create either, please, backside, please. With the last slide, please. Okay, thank you. So assignment allotted was create one long answer question, one short note, one scenario based short answer question, one scenario based MCQ among the competencies allotted to the respective group. So in line with that, next slide, please. The competency allotted to our group G was competency related to the communicable disease, that is competency number 8.1, 8.3 to competency 8.6. But for today's assignment purpose, we have chose competency 8.1, that is describe and discuss the epidemiological and control measures, including the use of essential laboratory tests at primary healthcare level for communicable diseases. And these are there are n number of communicable disease but for today's presentation we have chosen COVID-19 as a topic in relation to the current pandemic situation. And the learning objective as per the topic will be taught either in the second semester, second professional or third professional, depending on the institute. So the learning objective at the end of second or third professionals, students should be able to enlist various coronaviruses responsible for ARI. They should be able to describe epidemiological determinants, mode of transmission of the COVID-19. They should be able to define what is meant by suspect and confirmed case of the COVID-19. Next slide, please. Next slide.
Yes, ma'am. Yes, I have.
So next objective is they should be able to describe the clinical presentation, should be able to identify the risk factor for COVID-19. They should be able to describe the laboratory diagnostic methods for the COVID-19. They should be able to discuss the management of COVID-19. And last, they should be able to describe infection prevention and control measures for the prevention of this COVID-19. So in line with this, next slide, please. We have prepared one large answer question This kind of a large answer question can be utilized during the internal assessment exam of a second or third professionals, or that can be used in a university exam. So the scenario created here is Mr. XYZ, 58 years old businessman, came to the primary health center along with his son. He has a complaint of a fever, myalgia, weakness, running nose, and sore throat for the last 4 to 5 days. On history taking, medical officer it found that he has a history of diabetes since 10 years and he is on oral hypoglycemic drug. He has a poor compliance to the anti-diabetic medication. On further inquiry, he has a history of travel to the ABC city in the last week, and one of his co-passenger was also suffering from the same complaints. On examination by medical officer, Mr. XYZ is a conscious, well-oriented, febrile, a temperature of 101 degree Fahrenheit, pulse of 110 beats per minute, a respiratory rate of 28 breaths per minute, BP 110 by 70, SpO2 90%, and on auscultation, there were crepes in the right upper zone, but on CVS auscultation, it was normal heart sounds. So with this scenario, we have framed a long answer question, including the following questions. That is, what will be the probable diagnosis for this case? 1 mark. What will be the investigations advised by the medical officers? 2 marks. What will be the line of management or treatment for this case? 2 marks. And what will be the advice given to the patient, to his family members and society members by the medical officer? 3 marks. So this is our first larger answer question related to the COVID. Next slide, please. We have also created a short note on the same disease or topic, that is COVID-19. And such kind of a short note will be utilized in internal assessment or during the summative assessment for professional second or third. So the scenario here is, in a city, XYZ city, a medical officer at urban health center observed that in a C ward area, there is a sudden increase in the cases of ARI. We are expecting here as a COVID-19 scenario since last 7 days than earlier month, and an immediate meeting was called by the medical officer to all the staff members at a urban health center. So with this scenario, we have framed a short note consisting of a following questions. Question 1, what will be the agenda for the meeting, or what planning will be discussed in this meeting? That will be of 2 marks. And the second question is, describe what prevention and control measures will be carried out by the health workers in that area, for 3 marks. So this is the short note. Next slide, please. For the short answer questions, which can be again utilized for the second or third professional during internal or summative assessment. The first scenario is, Mr. XYZ is a 30 years banker male suffering from fever and sore throat for last 3 days. And on rapid antigen testing, he was negative. Here we are again expecting COVID-19. And on history taking, there was no family member suffering from the same complaint. So question here is, what is the confirmatory test for this person? And the second, what will be the advice to the Mr. XYZ by the healthcare worker, for 1 mark? So just a slight variation in the above question. Mr. XYZ, 30 years banker male, diagnosed as a case of a COVID-19 by health worker on rapid antigen testing at his workplace. On history taking, he was asymptomatic. No one in the family was suffering from the COVID-19. So the question is, what will be the advice to the Mr. XYZ by health worker? This question will carry 2 marks. So such kind of a short answer questions we have prepared from this topic. Coming to next slide. Next slide, please. Coming to the multiple choice question, which we can use during formative assessment or during second or third professional exams or during NEET exam also. So here MCQ scenario is, it's not related to COVID. We have taken as a general case of ARI. A 25 years old mother brought her 2 years old female child to the A&M at sub-center with a history of cough and fever for 4 days, and child was with an inability to drink for last 12 hours. On examination, child was having weight of 7 kg. Child was febrile. pulse was 90 beats per minute, respiratory rate of 45 beats per minute. Child was assessed by A&M and categorized as a case of first option, no pneumonia, second, pneumonia, third, severe pneumonia, and D, very severe pneumonia. So this was a new task, and all of us are aware making scenario-based question is a new beginning in this CBME. In line with that, I would like to share my reflection while preparing this task. Next slide, please. So what happened? An assignment on assessment of knowledge was given by resource faculty to each group as per the competency allotted in the CBME course in this community medicine subject. So what? Being a participant of this course and it was a group task, I volunteered to prepare a scenario-based long answer question, short note, short answer question and MCQ. It was my first time to prepare such kind of a question, as in earlier faculty development program like revised basic course or CISP program, we used to enlist assessment method as a part of the project activity, but never framed scenario-based question. It was totally new experience and I enjoyed this task. After a lot of discussion and inputs from the group members and the facilitators, I could complete this task and I am presenting today as a part of my assignment. So learning point from these tasks are a lot of preparation is required to frame such kind of a questions in assessment. Learning was challenging, but it was an innovative concept. Preparing conceptual framework for such kind of a question is really difficult, but not impossible. Application of a think, pair, share was helpful to complete this task during my assignment preparation. And frame the question, share with your colleagues or friends, then take the peer review on this question, and then again reframe the question to refine your questionnaire is the mantra for good quality of such kind of a question. So what is next? I will implement it as a routine task for the assessment in my department, and it will be helpful for the faculty to assess comprehensive knowledge of the learners or our medical graduates. Next slide, please. With this, we are moving ahead. Next step of assessment is a assessment of the knowledge. So I would like to invite Dr. Chandana to take a session ahead. Dr. Chandana, over to you.
Hello, good evening, Dr. Jyoti, and my respected participants, as well my respected facilitators, and all the participants who are today joining our session. Am I audible?
Yes.
Hello?
Yes. Yes.
Am I audible? Okay, thank you, sir. Okay, I'm extremely sorry that I couldn't join properly today because I would have liked to go into a video mode. But however, of course, we will go on with the session. My part today is assessment of skill. Assessment of skill and the logbook activity session. Now going on with the competency that has been allotted to us by our facilitators, we have been given the competency of 8 about communicable disease, and for skill assessment we have chosen competency 8.6, which is educate and train health workers in disease surveillance, control and treatment, and health education. Now for this competency, we have broken it. May I have the next slide, please, madam? We have broken this competency into specific learning objective. So now for skill, to assess skill, what I have done, in a small learning group, the 25 students that would be allotted to me, I like to, going in line with COVID, after taking the theory classes and the long lectures, in my small group discussion, what I like to do is to train my students first about the various preventive aspects of COVID-19 disease. For example, in hand washing, donning and doffing PPE kit, biomedical waste management, spill and linen management, and also about health education on the preventive aspects of COVID. So this will be the areas where I'd like to assess skill of my phase 3 students, either in 6th semester or in 7th semester. So after elaborating or deliberating with them in one of a small group discussion, what I like to do, I like to divide Yes, I like to divide my 25 students into roughly group of 4 students each into 6 groups and like to allot them a part each. For example, first group will be given the part on hand washing, the second donning and doffing, the third biomedical waste management, fourth spill and linen management, and the fifth health education part. And then also I'll divide my health workers into each of the group. For example, hand washing, they'll be training it to ASHA, ANM, MPW doctors as well as grade 4. May I have the next slide, please? Now for today's session, today's webinar, what will I do? My students, the 6th and semester students, will suppose they'll perform a training session for health worker. I have considered ASHAs and ANM in hand hygiene. Now, I'm extremely sorry that I couldn't go to video mode. I'd like to do a role play here. But however, since I'm not being able to, first I like to do it verbally. Then I like to request one of my panelists to join me on a video mode. Now here, I like to elaborate or deliberate on the steps of hand hygiene. Now, how will I actually assess them in hand hygiene? So what we have done, we have prepared a checklist, and the steps of the checklist will definitely be elaborated to the students as well. I'd like to request all my respected facilitators as well as all my respected participants that we will be sending you a PDF format of this checklist into the common WhatsApp group of CBME that we have. If the slide is not very clear to you, may I request you all to kindly run down through this checklist. So these are the points via which we'd like to assess the skill of training of health workers by our phase 3 students in hand hygiene. So what are the steps that we want them to do? So we'd like them to introduce themselves first to the health workers for rapport building. Secondly, to explain the importance of hand hygiene. Thirdly, to explain the 5 moments of hand hygiene, like when to do before touching a patient, after touching a patient, before doing a procedure or body fluid exposure, after doing a procedure, and after touching a patient's surrounding. The fourth activity is elaborate on the essential requirements for an effective hand wash. Like they should explain to the participants that a sink with an elbow tap is necessary, running water is necessary, soap and hand wash, instructions showing the 6 steps in hand washing, and a paper towel or air dry as applicable. The fifth step, removing any rings, watches, ornaments, etc. before hand washing. The 6 steps, perform all the 6 steps of hand washing methodically, one after the other. This 6 step is important because all the 6 steps has to be shown by the participating students in order to be marked as successful, like palm to palm, back of hands, between the fingers, knuckles, fingertips, and thumb. And lastly, what we expect our participant student to do is to check the understanding of the audience either by asking question or to ask them to demonstrate. If we look onto the right hand side of the screen or to the lower part of the PDF format that has been given in the WhatsApp group, some provisions we have kept, like the 6th activity, like we have said, has to be done correctly step by step in order to meet expectation. Activities which have subheadings, for example, our activity number 3, explain the 5 moments of hand washing. Elaborate on activity number 4, elaborate on the essential requirements of an effective hand wash. And the student should at least be able to say 50% of the activities that they have. Now, a student who is able to perform all the 7 steps in the checklist will be assessed as having a skill of above expectation. A student who does 4 or more activities correctly, including point number 6, methodically, that student will be marked as meeting expectation. And a student who does less than 4 activities or more than 4 activities, but serial number 6 not done methodically, that student will be marked below expectation. So after this, after having going to the checklist, now may I request Ritu ma'am, Dr. Ritu ma'am, to kindly join in the video session and show us the 6 steps of hand washing. Okay, so now Ritu ma'am will be Actually, we'll be doing the role play of the hand washing steps. All my peer panelists, we are the one who are learning from her, and all my respected facilitators and fellow participants, you all are the assessors whether we are correctly doing the step or not. So kindly, I like to request all our participants to kindly note down how Ritu ma'am has been going about doing the step. Over to you, ma'am.
Thank you, Dr. Chandana. So, good evening, everyone. Myself, I am Ritu Parna. I am a sixth semester student who is given the responsibility today to show you the 6 steps of hand washing. So, please kindly do with me, and I hope all of you can, learn from this that how to do the hand washing procedure. The first step for doing hand washing is palm to palm. We have to rub our palm. Should be palm to palm. So since after doing this, second step is doing back of the hands. We have to go for washing the back of the hands. After that, third step is in between fingers. So we have to clean between the fingers. After that, we have to clean our knuckles. So like this for one arm, then another like this for the another hand. Then we have to go for this tip of this fingers for one hand, then for another hand. And the last step is for the thumb. So like this, we can finish the 6 steps of hand washing.
Okay, thank you, ma'am. Now, since we have done the all the steps, may I have the next slide, please? We will also like to take this, mark this activity, mark this skill in as a logbook entry. May I have the next slide, please? Okay, already done. We have done a brainstorming, and now what we'd like to do is to enter this activity conducted by the sixth semester student into our logbook. So, as we all know, the logbook entry format is such where we mark the competency address, the name of the activity, the date on which it has been conducted, the attempt at the activity, whether it's a first, a repeat, or a remedial one, the rating that will be given by the preceptor, whether the student has met expectation, has exceeded expectation, or is below expectation. The decision of the preceptor, whether it's a complete, repeat, or remedial, the initials and of the preceptor and the date, and the feedback which has been received by the student. Now, if we consider this as a role play, may I request my respected facilitators and all my dear participants to kindly fill up the form that has been given. May I have the next slide, please? In the common WhatsApp group. May I have the next slide, please? Kindly rate our activity. Kindly, may I request all the dear participants to kindly read this activity in the logbook form that has been shared in a WhatsApp group, which bears surveyhard.com, and time allotted is 3 minutes for all of you. I'm getting responses. Thank you. I'm indeed grateful to you all for participating. Please participate. Thank you all. We have 1 more minute to go. We, the team of GENEZENS, are really thankful to all the participants because I'm really getting a very good response from you all. Okay, 3 minutes is done. Should we move on to the next slide, to the next part? Okay, so I'd like to draw the attention of you all. This form has been submitted by Sri Vidya Madam. She has entered in the logbook like the competency addressed 8.6, name of the activity, skill assessment of hand washing. Then date is today. Attempt activity first. Ma'am has marked me a meet expectation, or ma'am has marked us, or I may say Ritu ma'am, meet expectation. Vidya madam, can I ask you to unmute and just say why you think we have met the expectation?
Okay, Chandana ma'am. Actually, when you have shared checklist, you have given the criteria, what is there for below expectation and meeting expectation, because the demonstration done by the Ritu ma'am has activities of all 6 steps of hand washing, and also she has introduced herself, and also she has removed her ornaments from the hands, etc. So that's why I wrote meet expectations as per the given checklist.
Okay, thank you so much, ma'am. Okay, thank you so much, ma'am. So
Thank you.
this way, thank you, ma'am. So this way, when we plan a skill and for our logbook activity, we thought that the checklist would be best. If we make up a checklist, then marking a logbook entry becomes easier. So may I have the next slide, please?
Yes.
Okay, so rest of the part is numerical scoring of activities not required here. Documentation in portfolio or annexure of logbook, yes, it is required. And if the level is not achieved, definitely will provide feedback with correction. If the student does not pass in the first attempt, 2 repeat attempts will be given after the feedback session, and she will be allowed to some learning time before the repeat. And if the student doesn't pass even after 2 repeat attempts, then he or she will be made to complete the activity with the help of a facilitator. And this is how we have assessed the skill and also made a subsequent logbook entry of a preventive measure of COVID-19 disease. So now I'd like to request Ritu ma'am to take over the next part of the session on formative assessment. Thank you.
Thank you, Dr. Chandana. So, good evening, everyone. Myself, Dr. Rituparna Das. I am working in Agartala Government Medical College, and today I'll be presenting the formative assessment tools in community medicine. The assignment that was allotted to us was to identify tools for large group session and to identify formative assessment tools for small group sessions. Thank you. Ma'am, please, next slide. Ma'am, next slide. Yeah. So these are the formative assessment tools that we have identified for our large group sessions. Like if we aim to assess the knowledge among the students, we can use MCQs, quizzes, or for if we want to assess comprehension, we can use problem-based MCQs, strategic questioning, admit-exit tickets, etc. If we want to assess the application and analysis abilities among the student, we can ask the student to go for paraphrasing in a simulated environment, or we can ask the students to go for student generated test questions. However, if we aim to assess the students' reaction to learning, we can use exit tickets with 3 to 1 countdown or 2 roses and a thorn, feedbacks, opinion polls, etc. Next slide, please, ma'am.
Yes.
Ma'am, next slide.
Yes.
Okay, so these are the tools that we have identified that can be used for small group session after like say seminar, case presentation using Viva, Voce and feedback, or say OSCE, OSPI, OSLAS, etc. in case of practicals. However, many of these tools have been discussed elaborately and very nicely by the previous presenters like say group I and group J, and group H has presented very nicely the Kahoot. So we have decided that today we'll not elaborate any of these tools in details. Instead, what we have decided that we'll try and demonstrate two of these formative assessment tools in our presentation through Google Form. The first tool that we have decided to assess today or use today is formative assessment of seminar presentation. So what we have planned is that we have developed a Google form where we will ask our group members and as well as the participants of today's session. I would request, I would have an earnest request to all the participants, if you can please kindly assess and become assessor for our presentation and assess the seminar according to the tool that we have formulated as per formative assessment. Ma'am, can I have the previous slide? Previous slide, ma'am. Previous slide.
Yes. Is this? Yes.
Yeah.
Large group sessions. Yes.
Yeah. The another tool that we are going to use today is a type of exit ticket, that is two roses and a thorn method. So basically this is an exit ticket that is usually used after a large group session or like lecture, where we ask the students to tell two good points or two interesting points regarding the lecture and one thorn, that is one bad point or one muddiest point about the lecture. So the next or the second part of the tool that we will be using today is two roses and a thorn method in the same Google form. So we would also request our participants to give us a feedback what they liked, if they have liked something from our presentation, and what they did not like from our presentation, so that we can rectify it for future. Ma'am, can I have the next slide?
Yes. Yes. Ma'am, small group sessions. Is it visible?
Next slide.
Next slide. You want. Okay. Is it okay?
So yeah, okay, thank you, ma'am. So basically this is the Google form. If you please kindly open our CBME community medicine WhatsApp group, we have shared the Google form, linked for the Google form in that in that WhatsApp group. We have done two sections in the Google form. The first section is the formative assessment of the seminar presentation, or like say today's presentation. Please consider our today's presentation as a presentation, and you please assess our presentation in terms of our contents, presentation skills, etc. And the second session will be the exit slip of two roses and a thorn, where you are asked to write in short, like say two good points and one muddiest point regarding the presentation. It will be allotted will be 3 minutes for this. I would request please everyone cooperate with us, and please try and give feedback regarding this our presentation. So if you open the slide, you can see, or sorry, if you open the link for this Google form, you can see the first section is formative assessment of the GENEZENS presentation. Here we have graded them in terms of content of presentation, relevance of the assigned topics, organization of presentation, and presentation skills. So if you like whatever is your response above expectation or around expectation, or even if it is below expectation for our presentation of today, please, I would be very glad if you give us some grading regarding that. So it will be an eye opener for us so that we can improve ourselves in future. The next section, if you can see, like if you are using your mobile phone, then after you fill up this first form, you can have a next button at the end, so that you can go to page 2. And if you are using computer, you can have it at the bottom, like if you scroll down, you can see roses and a thorn exit slip. So in that slip, please kindly see if you can, have, we have put question like 2 things you liked about today's presentation and 1 muddiest point from today's presentation. I'm getting responses. I'm very thankful to everyone because you are, taking the burden to give us feedback regarding this. Thank you so much for your responses. We have got a good number of responses and we can show the presentation. Uh,
Dr. Ritu, do you want to share
yeah,
screen?
yeah, I would like to share.
Okay. Okay, I'm making you the presenter.
Yes, sir. Thank you, sir.
Shall I stop sharing?
Sir, is my screen visible?
Yes, yes, yes.
So
Yes.
if everyone can see that my screen is visible, I would now stop accepting new responses by clicking here. And I would like to share with you what feedback we have got you from all the respected participants of this session. So for the content of presentation, we have seen that almost 63.3% have shared that we are meeting the, we are above expectation, and I am very glad and I want to really thank you for considering this. Regarding the relevance of the assigned topics, we are like say 53.1% are thinking it as above expectation, whereas 46.9% are considering it as around expectations. So in future, we'll obviously try and make it much better regarding the assignment topics. Organization of presentation, 65% considered that it was above expectation, whereas few considered that it is below expectation. I can understand that we had some issues regarding sharing of slides and everything, and for organization of presentation, if moreover since we are staying in different cities, we could not coordinate that much, but hope we will be doing it in a better way in future. Regarding presentation skills, I am very glad that almost 70% they considered that we are having above expectation presentation skills. Thank you so much. Regarding the second section, that is two roses and a thorn exit slip, If you can see, like, two things what the assessors or the participants liked about today's session was, mostly they have said regarding elective and knowledge. Then they have said regarding good concept about presentation, innovative procedures are used, interactive and live demonstration, new assessment tools. So thank you so much. A lot of good things has come up from from the participants. They liked about us for our today's presentation. I would also like to show the muddiest point, like, if we are taking the roses, we should be bold enough to take the thorns also. So muddiest point, if I see that majority has said, okay, they are saying nil. And okay, this one they are also saying nil, nothing. So I'm very glad that majority it is, yeah, no video during role play. Yeah, this was a problem because we had some network issues. So during the role play, only one of us could take participation, not others. So like this, I think it was a very good feedback, and it is very kind of you to bring out some time and give us the feedback for today's presentation. So with this, we have come to the end of our presentation, and I would like to give our sincere thanks to our Pankaj sir and Parag sir, because they have been very supportive throughout our course and constantly guiding us, like what way we are going wrong, how and all. And finally, I would like to sincerely thank our Sanjay Bedi sir, because without whose vision today, whatever we have learned during the CBME course, it would not have been possible. I think we have grown wide amount, like say to what we are today. Like our group name means Genezens. Genezens means born to heal. I think we all are again reborn as a competent teacher at the end of the course. Thank you.
Thank you, madam. Parag, am I
Thank you, sir.
audible?
Yes, sir.
Okay, really good presentation, and I'm not saying only because I am the part of the group and the facilitator, but it was really good, as we have seen lot of messages which are coming here in the question section or in the WhatsApp group or our faculty group. Before we open up for the questions and the participants and the facilitator to speak, I just want to thank Sanjay Bedi sir and all my group members and all the participants, because of which the today's program was a great success. Uh, I can boldly say, though they had planned in having a double video and all those things, and suddenly at the technical hitch, in this kind of difficult scenario, they immediately changed their plan and worked very nicely, and really came with the flying colors. This indicates that CBME course purpose is achieved, and I'm really thankful to Bedi sir and informed that we have achieved lot of objectives through your course. And also thankful to all the participants who are active enough to give the responses. Many times when students do not respond, we feel sad about it, what is really going on. And really for that, I want to thank all the participants also. Really congratulations to the group G, all the participants who are attending this program, and our team members and Sanjay Medi sir. Over to Parag and others for their comments and question answer and other opinions. Thank you.
Thank you, Pankaj sir. As I see, there are not much of questions coming today. So I'll congratulate the entire team for providing us a hands-on learning in many of the components that they have presented. And in short time, they could do really well. And also, I'm happy that Jyoti madam could come out with a reflection. So that is good that she was inspired to write a reflection, and we could go through a simple reflection also written by one of our participants of the group. So with that, I bring it open to other facilitators for comments. We can, Dr. Ritu is sharing the PPT, I guess. Dr. Ritu, you can quickly run the PPT so that if there was anything specific,
Okay, sir.
we can recall. Yeah. Any of the participants also wishes to share something orally, please just let us know. Raise your hand.
Parag sir, good evening. Can I share my comment?
Yes, madam.
Ma'am,
Please
yes,
go
madam.
ahead.
Sorry, I was mute. Yes, madam.
Okay. No, I must say this group has very, well weaved all the interaction in the entire presentation. They have thoughtfully planned it and placed it in such a manner that the learning has occurred. It has been interesting, and at the same time, they have used various interactive methods, which kept the audience connected throughout. So I think very well thought of, and this is the way it could be made more and more interesting. So that's very nice. Congratulations to the entire group and the facilitators. I just had a small observation for the hand washing. She kept calling it a role play. So I think that was more like a demonstration rather than a role play. If I'm not mistaken.
Actually, ma'am, we planned a role play actually, but the thing was that on one side it was not working. So ultimately, then and then we have decided that we'll go for demonstration.
Yes, yes. You mentioned that the video was not there. Okay. I thought there was a slight misconception about role play.
No, no, ma'am.
But very well planned. Very nice.
Thank you for this idea to show us that a lot of skills can be shown and taught and learned on online mode in a COVID situation where the teacher can be on one side, student can be on other side. Still, lot of the skills can be done. Only when it comes to a clinical examination where patient has to be examined, there are some limitations, but a lot of things, skills which are always a hiccup, can be shown and taught and learned in the online mode. Thank you for showing that kind of idea during the presentation.
Pankaj sir, Sairu madam has raised a hand. Sairu madam, if you want to ask orally, you'll be able to unmute yourself. Yes, now you should be. Just a second, ma'am. Yes, ma'am, you'll be able to unmute yourself. Yes.
Yeah. You hear me?
Yes,
Okay.
madam.
I really felt proud when I was listening to this group. I mean, it's not that every time I can log in, but today I had the time and I really feel proud of the whole group. I understand that meticulous planning might have gone into how to coordinate the learning, lot of planning, lot of things. I'm sure that if we teach like this, if we train our students this way, they will surely be experts in public health. So I just wanted to convey my congratulations. Okay, thank you.
Thank you, madam.
Thank you, ma'am.
There is one question to the group. Parag, can I say? Ritu madam, am I audible?
Yes, sir. Yes, sir.
Yes,
Yes, sir.
sir.
Okay.
Sorry, I was mute.
Yes, sir.
No problem. There is one question that why you are asking for one diagnosis and making the student look at the tunnel vision. Why can't you ask for the probable multiple diagnosis or usually differential diagnosis? What is your opinion there?
Can I answer, sir?
Please go ahead.
Yes, ma'am.
Am I audible?
Yes, ma'am. You are audible.
Yes, ma'am. You are audible, ma'am.
Okay. We can ask like a differential diagnosis also here, but we are restricted here with the situation of a COVID, and in case of a pneumonia, there will not be many differential diagnoses. So that's why we have kept it as only probable diagnosis. But if a case scenario is in a different way, then definitely we can go for the differential diagnosis also, sir.
Thank you, madam. There is one more question with respect to Google Form and Kobo Toolbox. Just to explain, there are three kind of or four kind of methodology the group has used. One is the Google Form, which you saw at the end. Then they also use the surveyhard.com, which is something similar to Google Form. Then they use the PDF checklist, which we did not fill up. We just glance it if they are doing properly or no. And the first one which was shown in the map was the Kobo tools. There are many advantages and disadvantages of Kobo tools. Yes, the advantage, one of the things, Kobo tools can take geo coordinates and the person can be identified in the maps. Many times understanding GIS technology becomes very, very difficult. And if we are trying to do a simple survey and identifying those people on the map can be done. I'll request the group members who have actually created this Kobo toolbox and the map to explain further on that. Madam, please go ahead.
Yes, sir. Yes, sir. Myself, Vidya. I have done this Kobo toolbox for the data entry in the field. Actually, what I said is it is almost similar like Kobo tool, Google Form. Like that, we can frame the questions like in Google Form, because Google Form is so famous than the Kobo toolbox. That's why I'm telling in similar lines. So we frame the questions same like in Google Form, but here we can keep geopoint also. So by using Kobo toolbox, we can collect not only the data and also the geographical coordinates of the persons from where we are collecting the data. For example, this what I have shown in the map, they are the positive cases of COVID. Of course, this is not a real data, it's dummy data for the trial I have done. So these all circles are actually the locations of the positive cases. So that's these type of things we can train in the students. Hands-on training can be given, and we can sensitize the students that how we can use geographical coordinates when it is needed. I think I'm clear, sir. Sir?
Thank you, madam.
Okay, sir.
Any of our facilitators or faculty want to say something, their opinion, their
Ritu madam, you can run the PPT so
Okay,
that
sir.
if there is anything, uh, they can read.
Okay, sir. So up to this much was our slide.
Okay. Maybe if I can ask the members of group Genizens of your oral reflections, if you wish to. Jyoti madam has prepared a written reflections, but you have gone through implementing some of those formative assessment tools and logbook and those things. How was your experience and any specific learnings that you wish to share with others?
Sir, may I? Sir, may I? Hello?
Yes, madam. Yes, madam.
Yeah.
Yes,
So
madam.
Actually, when we first designed the presentation, we decided to elaborate each and every methods in a nice way. But then, as our facilitators also guided, then we also thought that many of these things has been presented previously also, like say previous presentations, especially by group I and J. They have done very nicely, and H has also demonstrated, group heroes have also demonstrated the Kahoot quiz app. So basically, we thought that rather than making it a thorough lecture, as our moderators also suggested us, that we should also make it little bit interactive. Then we have come up with this, that we, for the formative assessment, we will use some live demonstration with using, like say, Google form, or like say for the skill also we can use some checklist, the Kovo tool. All those ideas came up. And however, I would like to say that we were initially a little bit hesitant for role play kind of thing, or whether we'll be able to do it in a live session, the demonstration, or not. But at that time, we were a little bit hesitant. But our Pankaj sir and Parag sir, they really motivated us, kept us motivated, that we will be able to pull it through. Like say, if we try this out, and if it does not become successful on the day of presentation, especially with internet issues and all, that it will be okay. It is not that we have to be the best presenter, or we have to present very nicely always. And this has kept us motivating, and we we got that, okay, if even if it is bad, if we cannot pull it up at the last minute because of internet error or something, we'll do somehow whatever we can do. Because last time when we present group G presentation, there was again some internet issues, and there was interruptions, because of which we could not do very well, means as per our reflection. But this time we have learned through this process, like how to use this Kobo toolbox, how to use Survey Heart or this kind of form, how to use Google form. I personally learned so many new techniques while being part of this. Apart from say the routine CBME course, where we have learned so nicely regarding how to frame or how to frame the questions during assignment, how to go for knowledge assessment, skill assessment, how to use the logbook and everything. This thing was so nicely done in all the lectures. Besides, during this presentation specifically, we personally have learned lot of apps, how to use those apps, how to use those Google form, which we can now practice. We'll definitely practice it in our while doing some survey, or while doing formative assessment kind of thing in lecture classes especially, or even small groups. So this was my reflection, sir.
Thank you, madam. Parag sir, do you want to say, or there is one question which we can ask?
Yes, thank you, Ritu madam. Pankaj sir, we can take up that question. One more has come now also.
There is one question is there, that in the case scenario, the long case which was there, in that you have taken more of a clinical question. Can it be more public health question? This is $1 million question, when the clinical medicine stops and the public health of the community medicine start. I leave it to the faculties, the presenters to guide further.
Can I answer, sir?
Yeah, please go ahead.
Sir, here we are considering a single case scenario. That's why I have chosen a single case. But definitely, sir, we are a faculty from community medicine, so we can go for the public health kind of a scenario, and we can definitely frame such kind of a question, sir. This is my view.
Thank you, madam. There is one more comment has come. Not a question, just a comment. The group has presented this activity not like just an assignment, but they have done this and with their heart and soul, which resulted in a constructive and learning feast for all of us to enjoy. Thank you. Anything which a presenter wants to say on this kind of good comments?
Sir, can I chip in?
Yes,
Sir,
please go ahead.
hello. Yeah, like just on a lighter note, if I say, when we were given this task, we really made the slide in a hurry. And then when we had to do a presentation in front of our facilitators, no, not this. way, not this way. So then we moved through the phase of nahi karna hai, then acha karna hi padega, and then okay, we started doing, and then slowly we started enjoying. Last 4 or 5 days, the amount of conversation that we have had between the group members and our facilitators had really given us a lot of opportunities. I can tell, and even in my department, I have been telling all my colleagues, do log into CBME, do punch in those, do fill up my forms, do everything. And finally today, मजा आ रहा है, इसमें तो मजा आ रहा है. So we have come to that stage from absolute rejection to slowly liking what this CBME is, and probably we will also like to implement it. So again, thanking my dear and respected facilitators for really opening this world of opportunity for us, and this vast area of knowledge to us. Like we really did not, we were really unaware that things could be this way also. Thank you.
Thank you, madam. It is something, the comment which I read in today's newspaper. Everest is still high, but we enjoyed the living at the Everest, whatever height we were aware about it. Thank you, madam. Really, it was a good thing to carry forward in a live session. And I repeatedly said, even last time, doing something in a live session is really a courage. And even if it goes wrong, we should appreciate the person who has come out of the soft corner or the soft place and have a courage of that. Over to Parag.
Yes, sir. Sir, two, three things. One is, as rightly mentioned by Dr. Rupesh, that we should probably also try and frame questions around the public health related competencies. And as we move forward, we'll probably be able to do. One of the things that we ended up discussing in the internal facilitator group, and probably Jyoti Madam also mentioned in the reflection, is that it's challenging writing case scenarios. So probably we will take our own time to prepare case scenarios and be good at it, and then also frame public health related questions around this. One solution to this could be the from where could the questions come is if you like relook at our SLOs, probably that those are the places from where the questions would come. If you look at the real life situations in the questions that people can possibly come up with, there is the place where these questions of real public health questions would uh, possibly come up from. Another aspect was the reflection that Ritu Madam shared about the videos. So in many of the faculty development programs, this is what we have observed, that whenever faculty members as participants are told to shoot a video, there is surely an initial hesitation. The hesitation comes from the fear of not being able to perform perfectly in a video, and which is fine. So everyone goes through that probably, and probably that fear is one of the reasons why we do not see so much of role plays on communication skills and so many other soft skills around from Indian subcontinent. So if we see the YouTube, there we see so many different videos coming from the other countries, but not so many from our subcontinent. And probably part of the reason is that we have a little amount of fear that if I shoot a role play on communication skills, what if I do not myself being a doctor, I do not perform perfectly in that video, and my video, I mean, I would be subjected to examination and evaluation by so many others who would watch that video. Probably it's time that we come out of that fear and do something. As Ritu Madam has performed this and all of us are appreciating, so probably if we also venture doing something of that sort, people would appreciate, and it would be a good resource for not only for ourselves to be used in future, but for the other colleges also. So I guess those were my 2 cents. Thank you.
Any of our faculty friends wants to say something, or maybe any of other presenters, or we can ask Chandana madam how she feels when her video is supposed to be come, but it is not coming, and she became the unseen, the actresses of the movie, or unseen hero or heroine, whichever way we terminology use.
Hello. Hello, sir.
Madam, please go ahead.
Sir, it was really very deafening moment for me when my video was not coming on. But again, I would like to say I really thank you, both my faculties and my team members, for really supporting through that unforeseen consequence and really leading us through to today's presentation. Thank you.
Actually, recently I read one line: leadership in crisis. They do things differently and they do different things. Probably this is a right thing to say, though you planned something and the other thing also worked out well. Parag, over to you or any other faculty or any other presenter.
Yes, sir, that is from my side, sir. If any other facilitator wishes to add anything, please.
I think everybody had a really good feast. And usually, when we have our heavy meals, we feel like tired and sleepy. Probably everybody is so satisfied, and that's why there is a silence. And sometimes this kind of silence is also very good. Parag, if everything is okay, can we close today's session 3 minutes early? If there are no
Yes,
comments from our faculty friends or anybody else,
yes, sir. Yes, sir.
hopefully we have a highest degree of satisfaction today. Thank you, all of you.
Thank you all.
Thank
Enjoy.
you, sir.
Thank you so much, sir.
Thank you.
Thank you.
Thank you.
Thank you, sir.